Hey guys, happy Tuesday. Thank you so much for being with me today. I am really excited and of course a little nervous as well for my Therapy Tuesday today because I'm actually going to be sharing my personal journey with mental health, depression, and anxiety. One of the main reasons I thought about doing this, and I've shared a little bit before too, in regards to my depression and my journey with depression and anxiety, is because there is still so much stigma surrounding mental health. And there is stereotypes also in regards to mental health. People think that the person who is usually bubbly and happy at parties and events is usually the furthest person away from developing anxiety and depression, and that is simply not true. I am the perfect example of that. I'm outgoing, I'm very bubbly, and I'm usually very happy. And I never personally thought that I would experience depression and anxiety, but I did. So first message that I want to share with you guys is that anyone can experience anxiety and depression. A second stereotype is that people with anxiety or depression have a look. So they seem like they're anxious or they seem like they're depressed. And that's not true because even while I was experiencing severe depression and anxiety, I had good days and I had bad days. On my good days, I was able to put on a dress and go to a party and pretend like I was okay. Where I wasn't. The next thing is, well, why were you pretending? Because you want to pick yourself up, because you want to be normal, because you want to fight those feelings and you want to prove to yourself that you're okay. So getting dressed up and going to a party is not necessarily because you want to fake how you're feeling, but because you are trying to fight this battle inside your own head and fight your demons, so to speak. So just because you see somebody and they are dressed up and they're smiling and laughing doesn't mean they're okay. So that's the other thing that I wanted to touch on. And last but not least is the experience of depression and anxiety. There is so many different varieties of anxiety, so many different levels of it. One person can be totally fine on a normal basis, but then they can have, a panic attack here and there. And another person can really be severely affected by anxiety and depression. So how do you measure how bad it is and how do you know it's very serious? Well, I would say it's serious if your anxiety or depression is getting in the way of your social, occupational life. What does that mean? That means that you are really unable to enjoy the activities that you previously enjoyed. You are unable to complete the tasks that you have to complete. So you're almost dysfunctional. I was like that. I had gotten to the point where I was unable to really keep in touch with my friends. I really didn't have any desire, and that's really odd for a person like me because I am very sociable and I really, really love being around people, and my friends are very dear to me. I really didn't have it in me to even make a phone call. I literally did not have energy and I didn't know what to tell them because all I wanted to do was honestly cry and be in my own bedroom. I was very withdrawn. As far as work, I had completely put away work. I could not work. I really didn't feel that I was in a mental place where I could help other people because I was a therapist at that point as well. So I completely stopped working. I lost a lot of my clients at that point. Some of them stuck and, came back a year or two later, but most people I referred out and most of them took the referral because they obviously needed the help and I was happy for them. And it was affecting me being a mom, me being a wife. I really was completely dysfunctional. So that's when you know it's very serious. And that's why I call my journey a very, very deep, dark journey into depression. I want to go ahead and start with the history that I had with anxiety and depression. So I'm an immigrant. I moved from Iran when I was pretty young, but I moved when I was still in a place where I really loved my home country, Iran, and moving away and the sudden knowledge of knowing that I was moving away. My parents shared with me a week before we left that we were moving because our green card got fixed at that point and we just had to come. So I didn't know we were coming, and that put a lot of anxiety and pressure on me at that point, and it started playing out in different ways in my life that I really had a hard time with understanding. I didn't know what these symptoms here and there meant. I remember I used to get heart palpitations a lot because going to school in America was really difficult for me. Not speaking the language was difficult for me. Seeing my parents hustle for every little thing because the country was just so unfamiliar to us. The language was unfamiliar, it was hard. So basically what I'm sharing with you is that there was glimpses of anxiety for me here and there, but I was always a very, very happy, normal kid. So I really didn't have a lot of anxiety or depression growing up. There was little its and beats here and there, but nothing major. I was fine. I ended up getting married early, so that probably put a lot of pressure on me because I really wanted to keep up with my husband, who was so wonderful, who was so educated. So I wanted to make him proud. I wanted to make my parents proud. But I was really young. I was 20 years old, married, going to UCI. And that's when I really had my first panic attack at UCI, when I felt like there was so much to keep up with. My marriage, I wanted to make my in-laws proud. I wanted to graduate with good grades. I wanted to go to graduate school. So there was a lot of pressure on me, and already having been an immigrant, the pressure of that mixed with all of this just really took me to a place of having anxiety attacks. So I was having anxiety attacks here and there. As I was going through my 20s, I was still okay. Then I ended up being a mom at 24. I think that also put pressure on me because I wanted to make sure I continue my work journey, my education journey, but still be a good mom. So all of this just kind of piled up until I had my second baby, Sienna. Again, I was totally fine. I mean, there was, the panic attacks that were coming and going, and there was some anxiety, but I was okay. I was living life. I was still this happy, bubbly person. And then I gave birth, and I started having complications after I gave birth. A lot of allergic reactions, a lot of different health problems after I gave birth, to the point where they put me on a lot of steroids to calm the inflammation and calm all these reactions my body was having. And I had no idea, and no one shared with me that steroids, there is something called medication-induced anxiety or medication-induced panic, and steroid is one of those medications that really can affect you in that sense. It can really, really affect your mental health, your anxiety, and it can make you very paranoid, obsessive. So I didn't know, and I was on a really high dose of steroids mixed with, just giving birth and all these complications. I was fine. 2 months into it, I literally lost it. I just remember one night walking around the house, I just kept saying, I can't do this anymore. I was panicking. And what I want to share with you guys is that there is a really, really fine line between sanity and insanity. And I literally saw it happen in front of my own eyes. I mean, I was a therapist at this point. I had dealt with a lot of anxiety and depression patients, and I just could not understand what was happening. I was at a loss of words for myself. I remember I was experiencing almost like multiple conversations in my head because a part of me knew that what was happening was anxiety and depression, and a part of me just thought that that was reality. It's all I could see. I was living it. So I really couldn't see what was a fact anymore and what was not a fact, what was made up in my head at that point into much bigger of a deal, and what was really going on. I guess what I'm trying to say is I couldn't separate the facts from what was happening inside my head due to depression and anxiety. It was very hard for me to be logical at that point. And so my journey of insomnia started then. I could not sleep at night. My mind was racing all throughout the day with so many thoughts, and that's when I realized, I'm ruminating, because as a therapist I would tell my clients, this is a process of rumination where you keep going around in circles in regards to your negative thoughts, and at some point you need to stop them. But it was beautiful because as a therapist it was so easy for me to see, but as a person going through it, I could not see that I am ruminating and my thoughts are getting the best of me, and I'm just going in circles. Everything seemed bigger of an issue. I remember I had a cut on my finger, and I was freaking out about this cut because everything was throwing me into a panic. Everything was throwing me into more of an anxiety. Everything small was becoming more and more of an issue. I really didn't know what to do with myself. It was affecting my husband. It was affecting my kids. I couldn't be a mom. I had a brand new baby on my hand. And so the intense anxiety turned into a depression. depression. So first it was intense anxiety and me trying to figure out what to do, go from one doctor to the other to figure out what was happening to my physical body. And I never thought I needed to tend to my mental health. I just kept thinking it's, these reactions that are getting the best of me. How can I fix the physical aspect? I have to say, my family, as wonderful as they are, they also didn't know. They wanted to be there, they wanted to support me, but they just kept telling me things that were not helping me at that point because they didn't understand it just as much as I didn't understand it. And again, that stereotype coming in, looking at me thinking, oh, Tina, my wife, my daughter, my sister, who is always okay, always laughing, always making everybody else laugh, what's happening to her? It was really just crazy for them. For a lack of a better word, they didn't understand it. And so I remember my husband telling me, you need to get a hold of yourself. You're a mom now. You are a professional woman. You need to be better. You need to do better. And all these things he was telling me to motivate me to be better were scaring me more and more because I really didn't know how to be better. I really didn't know what to do. I couldn't do it anymore. I had lost control. And so my angel came into my world. A friend of ours who is a incredible psychiatrist just randomly called me on the phone. I didn't expect a call from him. I picked up and he said, Tina, you need help. You need to take some medication and you are really anxious to the point where you're not able to sleep. And the crazy thing about not sleeping is that you're not sleeping because you're nervous, but what's happening is that you are getting more and more nervous because you need to sleep so that your mind can rest. And I wasn't allowing my mind or my body to rest. So he said, I'm going to put you on multiple medications. One is to help you sleep because at this point I hadn't slept for so long. And one is to calm you down. While being a therapist, I was 100% against taking medication. I said, absolutely not. I am not going to take medication. I believe in working things out. I believe in talk therapy, of course, because that's what us therapists do. We do not prescribe medication. Those are psychiatrists. And we like to believe that everything is resolvable with talk therapy. And so I said, no, absolutely not. Thank you, but no thank you. So I continued with, being in this dark path of trying to figure stuff out for myself, but really not knowing what was happening until I came home one day and my family had an intervention for me. And they were all sitting around, my sister, my husband, my mom, and my mom, who is normally a soft person, looked at me and said, you listen to me, you need to take these pills and you need to sleep. And I just said, I don't want to sleep. I don't need to sleep. I need to think. I need to figure things out. I need to do how to heal myself. And she said, you're done thinking. You need to take this so you can take a break from your patterns of thinking. So I remember I took that pill and I was so scared. I was mortified to take this pill. I thought it was going to kill me, but really what was killing me was my anxiety. And I remember it calmed me down. I went to sleep. I slept that night and I woke up the next day and I felt slightly better because I had slept after so long. But the crazy thing was that it was making me super sleepy. For 3 weeks, I remember the first 3 weeks of taking these medications, I was so tired. I was so sleepy because my body was not used to taking these medications. Every part of me wanted to fight against taking this medication and the anxiety one. And I just remember my family telling me, no, you have to stay with it. You have to stay with it. This wonderful angel, this psychiatrist that came to my rescue was speaking to my sister, telling her every day, do not let her get off this medication. She needs to take this. She has to stay consistent with it. And my poor sister, she was pregnant, she dropped her life. Every day she was spending time with me to make sure that I was taking the medication, to make sure I was eating. I had stopped eating, guys. It was that bad. I could not eat. I had zero appetite. And my friends and family know I love eating, so zero appetite. I was not eating. She was almost feeding me. She was bringing me a plate. I remember Isabella was making the food. Isabella is wonderful, my children's nanny. She was making the food and my sister would literally sit next to me and spoon feed me so that I could eat. I had lost so much weight. I was just in such a bad place mentally. I never thought I could get out of it. And so I needed them to tell me it's gonna be okay. I needed someone to tell me you have to eat. I needed someone to tell me you have to take this pill. Almost like a baby, I needed to be cared for. And so the first 3 weeks, I'm not gonna lie, were a challenge. It was a out-of-body experience for me to feel like a zombie. But he kept telling me, the psychiatrist, that, eventually this medication is going to be a part of your system. It's going to kick in and you're going to feel better and these symptoms are going to drop. Another thing with psychiatric medications, anxiolytics, is that a lot of them don't kick in until like 6 to 8 weeks, depending on your body. And so you take it, you see the side effects, and you don't see the progress. So I wasn't seeing that I'm getting better. All I was seeing was that I was falling asleep on a daily basis and I couldn't do anything. But I kept with it. I stayed on track. I took the medication. Slowly, I came to the realization that I have to do this and that I am not okay mentally. So I stuck with the plan. I took the medications. Within, I would say, 2 months, I slowly started to feel a little bit better. When I say a little bit, what I mean by that is I was able to wake up in the morning, because what was happening to me was that I did not want to wake up in the morning. I just wanted to take the pill at that point and sleep. I just wanted to sleep. I didn't want to come in touch with reality. I felt horrible as a mom. I felt horrible as a wife. I just felt like I was dropping the ball. I remember I was looking at my own pictures from my past and I was actually jealous of myself. It was the most awkward feeling you could think of, but I was jealous of who I was. I was jealous of the happiness I would see in the photos in my eyes. I was jealous of the feeling I knew I had experienced, and I thought that I will never experience that again. I thought this was it. This was going to be my life, and I was going to stay with this feeling that was literally killing me forever. And I remember my husband saying something to me. It stuck with me. He said, "The best is yet to come. And all you have to do is just push forward." And he gave me another really good piece of advice that I always actually write about, and I never give him credit, and he always looks at me and says, "How come you don't give me credit?" So I'm giving you credit now, honey. He said, "Live in 24-hour compartments." I really didn't know what that meant, so I researched and researched trying to understand what this meant. And what it meant was worry about morning to basically the next morning, but really you're sleeping, so you're not worried about that. So worry about morning to nighttime today, and figure out today. Figure out how you could do today, and tomorrow will work itself out. Worry about tomorrow, the next day. So I started doing that. I started living in 24-hour compartments. I would wake up in the morning and I would tell myself, okay, I'm gonna do my best to be present today. I literally had to push myself, like energy that I didn't have. Things that are just normal to us on a daily basis were abnormal for me. Like I said, even eating or just taking a shower was just abnormal. So I literally had to gather the energy so hard to just be able to spend maybe 1 hour of being present with my kids. And I think that's what really would shatter me into thinking I, killed myself for this life. I worked so hard to be able to be married to my husband that I was so in love with. So I had fought for every step of this life. I had 2 pregnancies that, the first one, the pregnancy was difficult, the second one, the aftermath, and I would just look at them and I would think they're so beautiful, but I can't enjoy them. And this is not my life. This is not what I had worked so hard for. It was just so heartbreaking for me. But I just pushed and I took the medications, and slowly, like after 2 months, every day was getting slightly better, but still I was so scared. I was so scared that I'm gonna go back to that feeling of the intense anxiety and depression that I had felt. I was so scared. So I just kept pushing. I slowly started to bring in more normal activities. So I remember I slowly started to work out. It was like maybe a 20-minute walk a day. And then I took the 20 minutes and I made it 30 minutes. And the 30 minutes I made into an hour. And I remember that 1 hour working out and fitness was really helping me, because I was working out hard enough where I wasn't able to think anymore. So I always tell my clients now, with so much more empathy than I did before as a therapist, start slow and increase, right? But try your best to do things when you can that will take your mind off of things. Once you are doing something that takes so much physical energy, your mind is unable to think as much. And that's really what was saving me, that 1 hour a day of me not being able to think. So that really helped me. Then I started really focusing on a healthy diet because I knew that my body needed to recover from all that toxic energy that I had been putting into my body. And I was trying to fix the allergies. So I researched a lot and I went into action mode. So one of my other things that I always tell my clients is go into action mode. You're worried about something, instead of sitting with the worry, do something about it. So for me, that meant, going and seeing an acupuncturist. I think that really helped me. It's a very personal thing, but I took a blood exam and it came out that I was really, really sensitive to certain food items. I took out those food items and I started really eating a healthy diet. So my focus became self-care, and I felt good knowing that I am putting my energy into something that could be healing me. So I started removing gluten and dairy, and I started just having a really good diet. I started exercising and I was getting better. But as I was getting better, I was still experiencing a lot of fear. I felt so fearful that I can't get through. And so I slowly started making myself busy. I remember I was keeping myself really active with the kids at this point. I really tried to just be super present with them and be in the moment with them, and that was helping me. And what really helped me was being really open with my feelings. So at this point, I was telling everybody, I am not okay. I am not myself. Please give me time. Please bear with me. I was very vocal about my feelings with my family, and I think it really helped them understand what I was going through, so they became more understanding. And knowing that they knew I'm on a journey to get better really helped me, because then I had their understanding and I had their support. But remember, when someone doesn't know what you're going through, they don't know how to help you. So it's really important to explain to people when you have the stamina to do, because at a point I didn't, but at this point I had developed that. I would share with them, and so they understood it, and because they understood it, they were able to be there for me more. And so I went through this, and then I remember we had tickets to go to Europe, and I told my husband there's no way I can go. I was so scared to be taken away from my home and this routine I had created for myself. I didn't think I could do it. But my husband basically said, we gotta go. Like, I have these tickets. Like, he didn't take no for an answer. So he took me. I was so fearful. And what I can tell you is that first night in Saint-Tropez, I looked around and I said, these people are living life, and I want to put away all this fear, and I want to put away all these thoughts that are killing me, and I just want to let loose. And I had a couple of drinks and I watched people dancing, and I started dancing, and I literally had this epiphany of, I want to live. And at that moment, I remember this sentence came to my mind: I want to live my best life. I want to be in best shape possible. I want to have the best clean diet possible, but I also want to have a blast. I want to live life for myself, and I want to let go of people's judgments, and I have one life to live, and I really want to live it. And that was really a life-altering, life-changing moment for me, when I decided from now on I'm going to live for myself, and I am going to live my best life, which is why my blog is called Living Your Best Life, because I really believe that, and I really believe that we are all capable of doing it if we really want. And so my message for you guys who are experiencing anxiety and depression is, anyone can go through it. Don't judge yourself. It's a process. You have to ask for help. At times you will have to take some medication, and that's okay. Don't do it unless you absolutely have to, but if you do have to, it's totally fine. Know your triggers. What is triggering you into not feeling okay? What is triggering you into that severe anxiety? Know your triggers, write them down. For a while, try to stay away from them until you have the mental energy and stamina to fight them, because you will be fearless at some point, but in the beginning you're fearful. So try to really be gentle with yourself. Don't judge yourself. If you need to sleep in, sleep in. It's okay. It's a process. You have to go through the process. Explain your emotions to your loved ones so they know what you're going through. And just believe in yourself. You will come out of it bigger, better, and stronger. And try to really research and watch motivational videos. That really helped me. And just know that there's so many incredible, successful, happy people that have gone through this journey and have come out of it stronger and better, and that that you are not alone and that you will get through it if you want to. Sending you guys so much love. Thank you for listening to me.